Welcome to this session, Digitizing Infection Prevention and Control to help manage COVID-19 and beyond. This session explores the implementation and subsequent benefits of an electronic infection control module that digitizes data associated with infections and outbreaks in long-term care. In response to the COVID-19 pandemic, PointClickCare made a conscious decision to bring their in-development infection control module to market early. They were hearing from customers the challenges being faced in managing all of the additional data associated with COVID-19 outbreaks. Offering the module early to customers was a way to help. To help set the stage for our panel discussion today, a brief overview of PointClickCare's infection control module will ensure all attendees are familiar with its features. Once logged into PointClickCare and with the infection control module enabled, infection control is found under Clinical under Care Management. The landing page for infection control is the daily overview with 3 options. The site defaults to the COVID-19 monitoring page. Here you will find confirmed, suspected, closed, open, numbers of cases that have been reported in the infection control module. As well, you will find strategically placed arrows that draw your eye to whether the trend is going up or going down with case counts. In the event there is a change in trend, the system will also trigger for an acknowledgement when there are changes. Moving to the infection monitoring chart, this view shows the number of confirmed, suspected, total open, and closed cases. Again, the strategically placed arrows show if the trend is upwards or downwards. Moving over to the dashboards. On this view, you're going to see tiles that represent total cases, suspected, confirmed, and closed cases. The default for this view is the duration is current month. However, the duration field allows the user to select another time window. The user can also opt to display the data for the whole home or for an individual unit. These features allow the frontline nurse to have a view that is applicable for their work, while the DOC may opt for a whole home view, a view that better aligns with the DOC role. Both features support real-time data analysis, which is a key infection control requirement under provincial licensing. The 5 graphs below display data from different perspectives. The first graph shows active cases by date, and the next graph shows new cases by date. The graphs are live, and as data is entered, the graphs update, allowing anyone to know at any given point in time how many active infections and how many new infections are in the facility. Further down, you will find a graph depicting various infections by type, as well as by organism responsible for those infections. In-house and externally acquired infections are displayed on another graph on the dashboard screen. The graphs and dashboards keep the trending of data current and accessible to all in the circle of care. Moving to the case list view, this list shows all infections based on the duration selected at the top of the screen. This is where you can enter a case, find the details of infections, and where you can update case information. Various columns allow you to sort the data. For example, the status column allows you to group confirmed cases, suspected cases, and closed cases. All data in this view is easily exported to Excel should you have further need to analyze your data. All graphs and charts are fed by the data entered as cases. Cases or suspected cases can be entered in 3 different ways. 1, through entry of a diagnosis of an infection in the Medical Diagnosis tab. 2, completing the infection control evaluation in the Assessment tab of PCC, once you have activated the assessment and it is available at the facility level. And the third is by direct entry into the infection control module by clicking Create Case. Irrespective of how the case is entered, the data to be entered is the same. Supporting clinical best practice, as soon as a case is entered in infection control, a red stop sign with an IPC appears in the resident header of the chart in PCC, alerting staff that the resident has an active or suspected infection. Based on data entered, a section within the case displays where information on items such as what PPE to use, control measures to put in place, and as well there is a link to the CDC for further information on a particular infection. Kept current, the case list has all the key information required for public health reporting. When the case list is exported to Excel, the system will bring in the date of birth, the gender, and the health card number for all cases that are entered in the system. In short, infection control within the electronic healthcare record ensures those in the circle of care have ready access to data both at the resident level supporting care, as well as the home level supporting proactive intervention, analysis, trending, and reporting. We are hopeful that the overview of the module will set the stage for our panel discussion today. So today we have 4 panelists with us, and they are representing multiple perspectives from within the home, including frontline care providers. We also have a mix of panelists from BC and Ontario who are going to provide a diverse set of perspectives on infection prevention and control. So I'd like to introduce the panelists today. First, we have from Madison Care Center, Annie Kinnamore, DOC, and Julie Babowski, a quality nurse. Hello, Annie and Julie. Next, we have from St. Joseph's Continuing Care Center in Ontario, we have Derek Soares, who's with IT, and we have Kim Gillette, who is the Chief Nursing Executive at St. Joseph's. So welcome to both of you, and thank you for joining us today. So we're going to get into our panel discussion, and I have some questions to help guide that discussion. And my first question, and I will ask the care group respondents to respond first and then over to St. Joseph's. What made you decide to implement an infection prevention and control solution for your home? What was it that was guiding your decision? So the care group.
Hi, it's Annie. So I should mention, when this infection control came to us from PCC, it was initially for COVID catching residents, but we don't have any residents with COVID. So we figured out on how we can use this specific tool on catching all infections, and it has been very enlightening. And I'll have Julie talk about what we sort of have been catching when we've been doing infection control using this tool.
Hello, it's Julie. Yes, I first started, we used to use our own spreadsheet for recording the types of infections we had in our home. So when PCC opened up the infection control module, I started using it as our data entry point. And then we started running the reports and analyzing it. We've only been using it for a few months now. So we're able to determine which specific infections are in each unit that we have here. We have 6 units. So then we're able to redirect our education to certain units on which infections are more prone on their units, and help the residents to decrease infections that way.
Okay, thank you. And over to St. Joseph's. What made you guys decide to implement an infection prevention and control solution? What was the driving force?
you want to take it, Kim, or?
I would say that when it was offered to us, it was at the very beginning of the COVID impending crisis. And although we did not have any cases in our facility, we were being proactive and anticipating that we were going to need something that was more easily accessible to track any trending in our facility. So that's when we decided to implement the module.
I would just add that the timing for us was really perfect, and we were when we received the notification from PointClickCare about this module being available, we were right at the beginning of the COVID-19 conversation, and we were already as a management team having multiple conversations about how are we going to manage this, how are we going to do line listing, how are we going to do communications. We were having all those conversations at the exact time that this email came in, so it really was for us a real natural to try this, at least at the time, because we were already having these conversations about how to manage and how to do this as efficiently as possible.
Okay, good. Thank you both. So my second question relates to implementation of a module. And of course, we know that it was during a fairly hectic time. Ontario was hit harder in long-term care than BC, but both provinces were undergoing considerable changes day to day as recommendations, screening criteria changed. So what did implementation look like for you? What were the challenges and the benefits as you tried to implement something in the middle of basically what was a crisis in long-term care? So if I could ask St. Joe's first, what did your implementation look like?
Yeah, I'd love to take that one. That's one of the most glowing things that I can say about the module is that I know that there have been some changes. This module in particular, we've implemented multiple elements of PointClickCare over the last number of years. I would say far and away, this is the easiest one from an administrative perspective, the easiest one that we've ever implemented. We basically got an email, advertising that the product was available for a trial. And we had it up and operational within like 24 to 48 hours. And wow. PointClickCare did a phenomenal job of sharing videos, and there were PDF instructions attached both from on the admin side and on the frontline staff side. So we didn't have to recreate any kind of training materials or anything. We just reshared what PointClickCare had already kind of provided on a silver platter. We passed that along. We made a really quick decision, and we were able to independently turn the module on ourselves and start using it really, really quickly. So it perfectly fit the bill for us because we were like you said, there was a lot happening at that time, but we were able to turn it around really, really quickly. And I think that's partially because, and Deb, you probably would know better, but I think the criteria and all of the information in the system is very kind of well entrenched in best practice. And I think that means by its design, it is very, it does what it does and it does it well, but it's not like other modules on PointClickCare where there is infinite customizability with some of the different practices and stuff. The criteria is very well established in the industry, so it makes turning it on really, really simple.
There really was no configuration to it. Once the security roles were assigned and you enable it through the care content directory, there really wasn't pick lists that you had to generate and come to consensus on. It was really an out-of-the-box solution. And over to Madison Care Center. So what did your implementation look like? What were the challenges and hurdles that you faced, or did you face any in implementing this solution?
For the implementation here at the Madison is that, when the module was first opened up, I started using it as data entry. And then, our fellow presenter said that very easy to use, easy to add the information, lots of choices to pick from for signs and symptoms. For implementation for myself, as I'm usually the one that's doing the data entry right now, we haven't rolled it out to our frontline staff. So there is no any concerns there with adding workload to them yet. but it's very easy to use, easy to implement. And yeah, there really wasn't any challenges getting up and going. The units, we would prefer if we could have a choice for floors added as well, because we got 3 floors and 2 units on each floors. That was, so when we do run a reports, we still do have to divide the residents on each unit. And it's helped in focusing our education where it needs to be with the care staff, depending on the infections on their units. You have anything to add, Annie?
No. Annie, did you have a comment?
No, I think it might lead into the next question, so I'll leave it at that.
Okay, thank you. Thank you. So in terms of outcomes, it sounds like implementing it was fairly straightforward and nobody really hit hurdles. Once you had it up and running, what are the outcomes that you've started to see from having this solution now available in your home? Annie, let's start with you.
Okay, I was sharing this already with the staff. One of the trends that we've already noticed that when we had a high UTI identifying in one specific unit, so we were able to target the training and education that needed. And what we did find out that we just had to review personal care with the care staff. The pad changing, was there personal care done between an incontinence pad change? And then we noticed a significant drop already from that. So we're able to target and identify at an early stage instead of waiting for more complications to occur.
Thank you. Kim, from St. Joe's perspective, what outcomes have resulted from your implementation of infection control?
We have been able to streamline our processes, tracking infection control rates and occurrence and incidents has been multifaceted in our organization with many people involved. And the reporting system is using language that everybody already uses to describe infections. So we already have a form that the staff were filling out. We're just transferring it to a different document, and then it's at everybody's fingertips at once instead of collecting data and sending it to somebody to put it on a spreadsheet and somebody else to review it to see if we've got any trends going. It's all at your fingertips once the initial report is done.
That's wonderful to hear.
On that front, Deb, if I could just add one more thing. It's really been one of the things that I've heard. We have opened up some of the data and the dashboard and that to the frontline registered staff. And for them, like, I think it's been really powerful in terms of communications and transparency for them to just be able to see the data, for us to basically say it's all there, you know, it's all available to everyone equally, I think is a powerful message as well.
It's that real time, how the system keeps those graphs and the data updated so that anyone looks at it at any point in time. And it is that real time picture of what's happening from an infection prevention and control perspective in that home. So thank you both for those, sharing with us those outcomes and the benefits of implementing this module. Kim, you mentioned about streamlining. So in terms of, I guess, just picking up on that just a little bit, streamlining that whole data collection and trending and analysis, which is part of any good infection control program. So do you have any thoughts around or insights into how much time that's saved or benefits?
I couldn't give you exact time. I just know that it came from being a multifaceted, multi-person process down to the data entry on the initial form, and everything generates from there. So as my background is a nurse. As a nurse, one of my biggest frustrations with documentation was how many times we document the same information in multiple locations so that everybody that needs to have it has it. This eliminates that. You document in one place and it's all there for everybody that needs it.
That's amazing, and no missing data when you only put it one place. So thank you, Kim. So moving on to the next, moving on to our next question. What's the impact on workload and activities of frontline providers as well as on management? And I think that kind of builds on what we were just talking about, Kim, in terms of the processes and the monitoring. But I'll ask Madison Care Center, frontline staff, or at least your data assessment and your data trending, what's been the impact on that? Annie or Julie?
Well, as we mentioned, we haven't rolled it out to our frontline staff to start implementing. Right now, it's Julie implementing. But I can see that we're going to be eventually rolling it out for the nurses to be inputting their own infection control. And right now, when Julie comes in, that's the first thing she does is she does her data entry, reviews any lab reports, and that's part of her routine when she comes in and she does it. So I'll get her to speak on how it's affecting her workload.
Thank you, Julie.
It's actually been much easier for myself to enter the data information, because one of the things we do when we first come is we read through the progress note. So I just make a note of anybody that has any infections, and then I can just quickly hop over to the infection control section and enter the information that I needed. Before, I used to keep a record and then have to get signs and symptoms, and then go into my other spreadsheet and then put it on there, and then the spreadsheet didn't have as much detail as what's in the infection control. It's just recording type of infection and how long. So it's a time saver.
Very good. Very good. So with COVID, we also introduced the complexity of working from home and remote work during the pandemic, and it was for some staff, some organizations. What do you see as the benefits of having the infection control up and running when you're thinking of remote work, or trying to be that DOC from home if you had to be during an outbreak? And we'll go to the care group first, and then we'll go over to St. Joe's.
I'll just mention that when you're working in real time, instead of waiting until Monday and waiting for the weekend for any issues, when you're doing it in real time, you can work from remotely, so you're always in the here and now. Right.
You're on top of it now. Okay. St. Joseph's?
Yeah, I could take that one. In our particular case, we made a conscious decision to all be in the facility. So we haven't really been, even amongst our admin group, we haven't been working from home or anything like that in the last few months. But certainly, we're planning for every possible outcome, and who knows what tomorrow will bring. So for us to just have everything electronic and have it, cloud-based and everything, it is good insurance for us, even though we're not necessarily working from home today. Who knows what tomorrow will be, or next week, or next month, or next year, really. So it's good to have that preparation for sure.
Good. So the next question, which is kind of starting to wrap up, what lessons have you learned from infection prevention and control through your experience over the last few months and with implementing a digital solution? St. Joseph's, will call on you first.
I'll go first. And then I'll pass it over to Kim. I think for St. Joe's, we've really seen, like I said earlier, the communications has been key during this time for us. So keeping the staff informed has been really, really important. And also kind of, utilizing our resources as efficiently as possible during this time is also really important because of constraints that are going on. we have largely been using the infection control module using the manual create case button that you demoed earlier, Deb. But we're actively looking in the fall to implement some of those assessments or to implement the triggering from assessments in the assessment section and kind of like further streamlining our process. But so like I would say that we're looking for efficiency across the whole organization and every nook and cranny in preparation for this second wave and for what's to come. So it's been perfect timing, the rollout of this application for us, for sure.
Great. Yes, we are all heading into outbreak season as we're now in September, so that will be coming. Over to the care group. What have you learned from your, oh, sorry, Kim, I think you were going to.
No, my
apologies.
Same as Derek. I just, I like the idea that we have it in place if we hit the second wave, and I really do feel that if we hit a second wave, it may be worse according to statistics. And being able to be transparent with the staff so that they feel safe as well, and they feel that they're keeping track of what's happening on the units is really important. And if we can't be present in the facility, we can access the information from home. So that's a double bonus.
Very good. Very good. Now over to Madison and Annie or Julie. Who would like to kick this one off for you guys?
Okay, so I think I could just go concur and add on to everybody else that it's so important to be transparent with the staff. And one thing that we're going to carry on this is that we're going to have an infection control committee. And I think it's going to be important to extract that information, and it's going to be actually faster to present the information so that it won't be, again, another time-consuming meeting to take away the nurses off the floor. So that's what we're going to be implementing as well.
That's great. I think talk about cutting down preparation time for an infection control meeting with the graphs being right there and all the data being readily available in the system. That's a great point, Annie. And Julie, did you have anything to add to that?
I think just with all the changes and all that stuff, right? Having a system that's easy to use, easy to get up and running, and add so much benefits is going to be quite helpful for decreasing our infections.
Okay. Thank you. So now if you could both, or all of you, both homes, but all four of our panelists, if you could think about one piece of advice that you would give a home considering starting this same journey to digitize your infection prevention and control data, what would that one piece of advice be? St. Joseph's.
I'll go first. I would say, again, I'm sort of repeating myself. I mentioned this earlier about the ease of implementation, but I could definitely see the perspective being that, it's a very busy time right now. I don't know that we have time to implement that kind of thing right now. Why don't we do that later? But I would say, it's more useful now than ever, especially with a flu season on the horizon here. It's actually, the best time, not the worst time, is what I would think anyways.
Kim?
The first thing I thought of when you said that was to coin a phrase from Nike, just do it.
Very good. Very good. Annie? One piece of advice.
Don't wait. It's very true. The do it logo is the best.
Okay. And Julie?
I would think, including infection control champions to assist the quality nurses and just get all the staff involved. It'll be more successful that way.
Okay. Yes, having everybody involved entering the data is the way to really streamline that data collection as signs and symptoms appear, just to be entering it. So thank you, Julie, for that. So this concludes our session today on infection prevention and control and the importance of digitizing the data that's attached to it. I'm hoping that through the stories of our panelists, you're able to gain a good insight into the requirements for implementation, into why it's important to just do it now, and that this is a proactive step in managing what may be proving to be a very difficult outbreak season with various types of outbreaks, whether it be gastro outbreaks, influenza, COVID, any infection type can be easily managed through the PointClickCare infection control module. So I'd like to thank our panelists for sharing their experiences today. It's not always easy to be on a panel and share experiences. So thank you all, to all four of you, for your participation today. And I'd like to remind all of our attendees at today's session that if you do have further questions or you are interested in the infection control module in PCC, please do visit the PCC virtual booth at the BC Care Providers Association conference. And thank you all for your time today. Thank you.